This video I will discuss Legionella pneumonia. Legionella pneumophila is the cause of Legionella pneumonia and it is a gram-negative organism. It spreads through water, so it is a waterborne pathogen. It is the cause of severe atypical pneumonia. The disease is called Legionnaires disease. It is associated with actually contaminated water systems like AC cooling towers. So through their aerosols it is transmitted. What is the mode of transmission? Inhalation of these aerosolized contaminated water through these AC hospital cooling towers. No person to person spread is seen. It spreads through inhalation. Risk factors. Patients who are prone to its infection are elderly, smokers and COPD because these all are immunocompromised. Also transplant patients are immunocompromised and patients who have already chronic lung diseases and patients who are diabetic. So immunocompromised patients are especially prone to its infection. Clinical features. As with all other pneumonias, patient has high-grade fever, chills, dry or minimally productive cough. Confusion is seen when there is CNS involvement. Also headache and lethargy. GI symptoms include diarrhea, abdominal pain and nausea. It is also seen in some other pneumonias like viral pneumonias, diarrhea, abdominal pain and nausea. Dyspnea and chest discomfort, as obvious it is causing pneumonia, so dyspnea and chest discomfort are evident. Important laboratory and imaging clues. The important thing is patient has hyponatremia with Legionella. So with Legionella patient has hyponatremia and it is characteristic for Legionella. Also it causes elevation in the liver enzymes. So it causes hepatitis. Chest X-ray shows patchy, multifocal or rapidly progressive pneumonia. So a patchy consolidation is seen on the chest X-ray. The most important test that is asked in exams is urine antigen test. It is fast and specific for Legionella pneumophila. So this urine antigen test is important regarding your exam points. How will you diagnose this? Urinary Legionella antigen test. It is preferred rapid test. While culture on BCYE agar is a gold standard investigation. Culture is gold standard while urinary Legionella antigen is a preferred and fast rapid test. Culture is gold standard. PCR can be done or serology can be done if needed, but these two are important: urinary test and culture. Culture is gold standard. Treatment. How will you treat this? As it is an atypical pneumonia, and in atypical pneumonia we use macrolides and fluoroquinolones. Macrolides, azithromycin, is given 500 mg either orally or IV for almost 10 days. While fluoroquinolones is levofloxacin 750 mg orally or IV can be given for 7 to 10 days. Start the treatment early because if you delay, especially there is high mortality in immunocompromised patients. Therefore, you should not delay treatment. IV route for severe disease is adopted. Prevention. Disinfection of the cooling water systems and regular monitoring of the water temperature and chlorine levels because it transmits through these water systems. Key points to remember. Think Legionella pneumonia plus means think of Legionella if there is pneumonia and GI symptoms plus CNS symptoms and hyponatremia, and also there are deranged LFTs. So think of Legionella because if there is pneumonia plus GI symptoms plus CNS symptoms and hyponatremia and deranged LFTs, it points towards Legionella. There is no person to person spread, only through aerosolized droplets from the cooling systems. Rapid antigen test is the diagnostic test of choice. Early macrolide or fluoroquinolone therapy reduces mortality.